What if cancer didn't just grow, but actually learned how to move? What if tumor cells could break away, travel through your body, and start new tumors somewhere else? That process begins with something called EMT. EMT stands for Epithelial-to-mesenchymal transition. It's a process where stable, structured cells transform into flexible, mobile ones. In normal biology, EMT helps with healing and development. But in cancer, it becomes a powerful tool for invasion. Epithelial cells are designed to stay in place. They're tightly connected, organized, and stable. But during EMT, cancer cells lose these connections. They change shape, become more flexible, and gain the ability to move through tissue. This is the moment cancer begins to spread. Once transformed, these cells begin invading nearby tissue. They push through barriers, break into blood vessels, and enter circulation. This step is called intravasation. Now, cancer cells are no longer confined, they're traveling. The bloodstream is hostile. Immune cells are constantly searching for threats. But EMT helps cancer cells survive. They become harder to detect, more resistant to stress, and better equipped to stay alive during travel. Eventually, these cells exit the bloodstream and settle into new tissue. There, they can begin forming new tumors. This is metastasis, and it's the leading cause of cancer-related death. EMT doesn't just make cancer mobile, it also gives cells stem-like abilities. They can self-renew, adapt, and regrow tumors even after treatment. These are some of the most dangerous cells in cancer biology. Behind the scenes, metabolism is changing too. Cancer cells undergoing EMT adjust how they produce energy. They increase glycolysis, adapt their mitochondria, and use reactive oxygen species ROS as signals. Low levels of ROS can actually help trigger EMT. EMT also makes cancer harder to treat. These cells resist chemotherapy, survive radiation, and avoid immune attack. They adapt quickly and become more difficult to eliminate. EMT is one of the most important processes in cancer progression. It connects growth, spread, and resistance. Understanding EMT helps explain why cancer can return and why stopping metastasis is so challenging. This is not medical advice. Always talk to your care team before making decisions. Learn more at helping4cancer.com.